This is Unit 2, ADN 820, Professional Nurse. Unit 2, Section C and D. Objective 18 says discuss the purpose of managed care. It is to provide cost-effective quality care that focuses on decreased costs and improve outcome for a group of patients. Basically, the care of the client is planned from the initial contact to the resolution of the problem. Care is delivered in the most appropriate and fiscally responsible way, and the emphasis of managed care is on cost controls, customer satisfaction, health promotion, and preventative services. Managed care systems combine care delivery with financing and provide comprehensive services for a fixed prepaid fee. The goal of these services is to reduce the cost of the expensive acute hospital care by focusing on out-of-hospital preventative care and illness follow-up care. So we're talking about taking, again, a patient out of an acute care setting and get them out into either home care or not even or preventing illness so that they don't go into the acute care setting at all. Objective 19 says illustrate the benefits of coordination of care. Coordination of care differs from collaboration by two critical differences. Coordination is initiated by the nurse, and collaboration can be initiated by the patient, family, or any member of the healthcare team. Coordination may or may not involve direct patient care, whereas collaboration requires direct interaction with the patient. So nurses do a lot of coordination, but physicians, nurses, patients, ancillary services all work with collaboration together. With coordination of care, it plays a major role in reaching managed care's goals of effective and efficient care. The nurse must know the patient's needs and the resources available to meet the patient's needs. It helps prevent errors, prevent disorganized care, and it helps prevent care that does not produce effective outcomes in the patient. Objective 20 says distinguish challenges to the healthcare system in the United States. There are several different challenges to the healthcare system in the United States. One is payment for healthcare received. Payment for healthcare received can be from public insurance like Medicare, Medicaid, S-CHIP, or Hawkeye. It can be from private insurance, either HMOs, PPOs, PPAs, IPAs, or PHOs, or self-paid by the patient, where they don't have any insurance at all. Healthcare systems try to use cost containment strategies. Because of the competition for healthcare, people start to shop around. Where can they get surgery done the cheapest? Also price controls, so that insurances put a cap on how much they will reimburse based on the DRGs. And then home care is really the big push for cost containment strategies. There is no reason to keep a patient for 6 weeks in the acute care facility for IV antibiotics if it can be done at home by a home health care nurse. There are nursing challenges to the healthcare system in the United States. Nursing challenges include shortages, and those are very cyclic in nature. The movement to home care affects nursing jobs, so we're seeing a lot of nurses move from the acute care setting to more of a utilization, long-term care, home health care setting versus the acute care. There's also cost-conscious nursing practice. This is where we limit the overtime while still delivering care in a safe and timely manner, and use only resources necessary to achieve desired patient outcomes. For example, if a patient needs a dressing change, take only in the 4x4s that are needed for that dressing change instead of a whole box of 4x4s, which are more costly. Objective 21 says compare various types of payment sources used to contain costs. Again, public insurance includes Medicare, Medicaid, and S-CHIP, Hawkeye. These public insurances will only pay for certain amounts based on the DRGs, or the diagnostic related groups associated with the insurance. Private insurance, again, does the same thing. There is a set fee for each diagnosis, regardless of how many services are provided, that the hospital facility will be reimbursed through, and that's through the HMO, PPO, PPA, IPA, PHO. They also have preferred providers. So in order to get the most payment for the services, the insuree needs to go to a provider that is within that HMO system instead of going outside of that HMO system. For example, sometimes with insurance companies in the Midwest, in Iowa, they will pay for Iowa physicians and will not cross the state line and pay for physicians up in Mayo Clinic because they're not part of the HMO. Self-payment, obviously self-payment has huge effect on payment because many people on self-payment don't have any insurance at all. And unfortunately, many of that does get written off by acute care facilities to keep a balanced budget. They do provide charity cases in some of that self-payment. Supply versus demand. Insurance costs have skyrocketed, and there's an imbalance between supply and demand. There's also been thoughts of billing for nursing services. It has been suggested to help reimburse the 24-hour care provided by nurses. Nurses do provide 24-hour care, and actually there is no reimbursement for that from insurance companies. Delegation. The purpose of delegation. Delegation is the transfer of responsibility and authority from an activity to a competent adult. The delegate is the individual who assumes responsibility for the actual performance of the task or procedure. The delegator is the individual who assigns the task and retains accountability for the outcome. Delegation is often difficult for nurses to learn because of the fact that it is a hard skill and not often practiced in the clinical facility before going and taking boards and becoming a registered nurse. There are 5 rights to delegation. It is the right person. Does this person have the training needed to complete the task? The right task. Things that can be delegated are things that don't need planning, assessment, things that don't need education, teaching, or evaluation, or interpretation. So it's important to know that the delegator still does maintain accountability for whatever task they delegate out. Example 23 says, examine the principles of delegation. Again, an unlicensed person may not delegate tasks to another person. It has to be a licensed person delegating to another person. The communication must be very clear, and the individual must understand the task and verify that they understand exactly what the task needs to be done. And delegation does not mean dumping. Delegated activities to unlicensed personnel must include clear, precise descriptions of the task to be performed, including subjective limits and expectations. Objective 24 says, list the benefits to delegation. It's a benefit to the nurse because the nurse can spend more time on activities that cannot be delegated, like assessment and education, planning the care, and teaching. Benefits to the delegate. It includes acquiring new skills and abilities and increased job satisfaction. There's benefits to the manager because they have a better functioning unit. And there's benefits to the organization because the goals achieved are achieved more efficiently with less overtime and absences, and it leaves them with an improved financial position. The 5 rights to delegation include defining the task, determining the appropriate delegate, determine the task, reach an agreement, and monitor performance and provide feedback. Again, those 5 rights for delegation include task, person, communication, circumstance, and evaluation. They kind of differ from place to place, but person, task, circumstance, communication, evaluation, or supervision. Tasks to delegate. For questions you need to ask first, are they routine? Do you as a nurse have time to complete them? And are they priority tasks that require any step of the nursing process? If they're routine, yes, they can be delegated. Do you have time to complete them? No. And are there priority tasks that require any step of the nursing process? No, then they can be delegated. And there are handouts in your Unit 2 section over delegation. List factors that affect delegation. Non-supportive organizational environment for delegation. Delegator insecurity, a nurse being unwilling to delegate. Unnecessary duplication of tasks. Under-delegation where there's not enough communication. Reverse delegation where CNAs delegate up, which is not appropriate. And over-delegation. Objective 27 says discuss supervision and how it varies from delegation. The hallmark of good supervision is effective delegation. Delegation is when nurses give responsibility and authority to an unlicensed personnel to complete a task. Effective delegation develops people who are ultimately more fulfilled and more productive and have more job satisfaction. Managers become fulfilled and productive themselves, and when they learn to count on their staff and are freed up to attend more strategic issues as part of their job. Objective 28 says differentiate between a manager and a leader. A manager has an official position offered by a facility to run a unit, department, or facility, and they are not necessarily a leader. A leader does not need to be in an official position to lead. They have the ability to rule, guide, inspire others to think or act as they recommend, and they have abilities to work with others to accomplish specific goals. Objective 29 says contrast various leadership theories and styles. We have authoritative or autocratic leaders, then they make decisions on their own without including any input from anybody else. Democratic leaders, which encourages group discussions and group decision making. Laissez-faire leaders, which have a hands-off approach to leadership and basically let decisions be made by everybody else. A bureaucratic, which leads by following the institutional policies and procedures with no flexibility in them. And situational leaders. And the situational leaders adapt their leadership style to situations. Sometimes they'll be autocratic, sometimes they'll be democratic, sometimes they'll be laissez-faire, depending on the situation that they are posed with. Contemporary leadership theories include the charismatic leader, and this leads the group through emotional relationship between the leader and the group. The transactional leader, where leadership is based on the exchange for some resource valued by the follower. Transformational leader, which empowers the group through creativity, risk-taking, commitment, and collaboration. And shared leadership, in which there's actually many leaders within the group itself. Illustrate characteristics of effective leaders. Leadership is a learned process. It requires an understanding of group factors, and principles of effective leadership include vision, influence, and acting as a positive role model. Please make sure you're reading your book on delegation, managed care, coordination of care, and leadership and management.